Basic Prescribing Skills Part 1. Medicines Reconciliation. Getting it right first time. There are many different types of medicines, and sometimes patients don't tell us the full history. Maybe the language is wrong. So we need to be mindful of this when interviewing them and trying to ascertain their full medication history. In Scotland, it's estimated that one patient dies every 1.3 days as a result of medicines harm, and over 1,000 inpatient beds are occupied every week as a result of medication harm. It's led the World Health Organization to cost medication harm at about $42 billion dollars a year. And as House says, everybody lies. Well, everybody pays the price for that when it comes to a wrong medication history. The Australians estimate that 3 in 10 medicines reconciliation errors have the potential to cause harm, and 1 in 6 patients are affected. So this is a big problem, which is why standard operating protocols have been established by the World Health Organization to make sure that medication accuracy is right at transitions of care. So this could be admission, transfer, or discharge, for example. Atal Gawande, a famous US surgeon, has published his checklist for surgery success, and it's based on the aviation industry's highly publicized mandatory checklists, which were used effectively by Sully Sullenberger, saving 150 lives by landing his plane on the Hudson River when all normal cause variation was outruled by a checklist. As Sully says, checklists help us focus on organizational goals and keep everybody reading off the same page. In Western Australia, a formalised medicines reconciliation method has been published, and you can see the importance of a process. The importance of process is highlighted in sport quite easily if we cast ourselves back to 2017, when Ireland recorded a historic victory over the All Blacks. An excellent outcome was achieved, and wild celebrations, not only on the island of Ireland. But that excellent outcome was not achieved without a ruthless focus on process. And the same can be seen with the Grand Slam victory over England a few months ago, where the handover that Tyg Furlong produced resulted in a famous Grand Slam try. Once again, a ruthless focus on process. So that begs the question, if we focus on process, can we achieve great results? Well, Formula One have managed to reduce their handover time to 3 seconds in the pits. So a massive improvement in response over the years, with safety, quality and productivity also realized. And that can only be achieved by the team focusing on key processes. So what is our process for medicines reconciliation and making sure we get admission medicines right first time? Well, pharmacy have been using a checklist on the drug chart for many years. We make sure that we ask the patient their date of birth, because if they can't tell us that, there's not much chance we'll get their history right, is there? And we use a gold standard of a patient that's well informed with their own medicines. Other sources of medicines information are less accurate. They may be the community pharmacist or the GP letter, which is not always up to date. When we use our checklist, we make sure we ask the patient, are they taking medicines they can buy without a prescription? Or have they ever had chemotherapy? Are they using transdermal patches, which can be quite potent at times? Or have they suffered from serious skin conditions where they may be using methotrexate or potent biologicals, for example, or perhaps steroids? And herbal doesn't mean harmless. So where St. John's wort is concerned and some others, drug interactions can be serious. And have there been any recent changes which perhaps may lead to admission or form the decision-making process for new drugs to be started on admission? It's important when a patient has been taking a drug before they came in to indicate that with a tick. It makes discharge much easier. And it's also important when holding medication to prescribe it and then hold it. And this avoids the complication of omitting it on discharge, which of course can be very serious. For example, if we held Plavix on discharge unnecessarily, it could result in stent thrombosis or myocardial infarction. Likewise, we may choose to hold several drugs due to acute kidney injury, but we want to make sure that we consider restarting them or making sure that they're never used again in the case of non-steroidals and renal artery stenosis. So getting medicines right first time is critical, not only to treatment, but to differential diagnosis on admission. And a better history may contribute to, as I said, better differential diagnosis. It will reduce the chance of unintended harm. And patients will certainly thank you for reducing their length of stay by getting it right first time and keeping them well informed of any changes, as will the GPs. So there will be an improvement in patient safety. And if the World Health Organization is correct, and I have no suspicion to think they won't be, a massive saving to the Exchequer. Thank you.